Hello, everyone. If you all are just joining, welcome to the NPRQI Monthly Forum. We are going to get started here in just a minute. If you haven't already, we invite you to enter your name and affiliation into the chat and let us know that you're here. We're going to give it another minute and then we will get started. All right, let's go ahead and get started. Good afternoon, everyone. Thank you all so much for joining the NPRQI Monthly Forum. My name is Lisa Inohosa. I am the Senior Program Coordinator for NPRQI. I see some familiar faces and names. Welcome. I also see some new names and faces. Welcome to everyone. We're going to go ahead and dive into some acknowledgements before we get started. The EMSC and NPRQI are supported by the Health Resources Services Administration of the U.S. Department of Health and Human Services as part of this award totaling $2.5 million with 0% financed by non-governmental sources. The contents of today's presentation are those of the authors and do not necessarily represent the official views, nor are they an endorsement by HRSA, HHS, or the U.S. government. NPRQI is also supported by the Toyota Way Forward Fund. NPRQI is housed at the Dell Medical School at the University of Texas at Austin. The university IRB has reviewed this initiative in full and determined that the project is exempt from human subject research. Now I wanted to hand it over to Dr. Kate Remick, who is the Executive Director for NPRQI, who's going to be sharing some information about pediatric readiness.
Thanks, Lisa, and thanks everyone so much for being here today. Happy October. Great to have you all with us and engaged in improving pediatric readiness. I'm just going to very briefly give a tiny bit of background on why we're here and the purpose of this program. Next slide, please, Lisa. So as many of you may or may not have heard, when it comes to emergency care in the United States, approximately a fifth of children will seek emergency care every year, but they go to EDs that are close to home. They're not coming to children's hospitals. So 80% of those children, which amounts to approximately 24 million, are going to emergency departments that are close to their homes. They're not pediatric specific emergency departments. So each individual ED may only see a few children a day, but collectively, that is where pediatric emergency care is happening in this country. And unfortunately, for many of these EDs, many that you may be from and working at, you see a lot of adults, and pediatric patients come in less frequently. And so it's hard to really understand how important it is to be ready for the pediatric population. On average, these general emergency departments see fewer than 10 pediatric patients per day, which means that the frequency with which we see highly acute critical illness and injury is very low. There have been reports that suggest that general emergency physicians perform less than one critical procedure on the pediatric population in a given year. So just exposure is limited, and that means that we really need to have our system framework and design in place to meet the needs of children. And that's what pediatric readiness is all about. It's not about making providers better. The providers are already fantastic. It's about making the system better, helping out with processes and resources to ensure that we're able to meet the needs of every child that comes into our ED. Next slide, please. So the National Pediatric Readiness Project is a program that's led by the EMS for Children program out of HRSA, but in collaboration with multidisciplinary professional organizations. And this is a national quality improvement effort. The goal is really to empower emergency departments and emergency department-based healthcare teams to improve the quality of care that's being delivered to children by way of being pediatric ready. The NPRP program offers a tremendous number of resources to help you get there. So our goal is just to make it as feasible as possible so that we can offload much of the work that any individual hospital has to do. If you were to go to the EMSC Innovation and Improvement Center website, and Casey may add some of these links into the chat as we go, but if you go to that website and click on Pediatric Readiness and EDs, you'll find that there's a link to the assessment, which is really a self-assessment, so you can see how you're doing in terms of pediatric readiness. It includes a checklist. There's a whole toolkit with tremendous number of resources, sample policies, templates, clinical algorithms that are within our pediatric education and advocacy kits. In addition, we have quality improvement collaboratives that we offer through the EMSC Innovation Improvement Center, and NPRQI is really a core pillar of this work. We have found through all of the National Pediatric Readiness Project efforts, which started at least 12 years ago, officially branded, but 20 plus years ago in terms of national efforts, that the two biggest drivers of pediatric readiness is one, having someone who serves as the pediatric emergency care coordinator. This is akin to being a stroke coordinator or STEMI coordinator. It's not someone who's necessarily seeing the patients, but it's making sure that the system is ready to receive those patients so that healthcare providers can perform at their best. And then the second is engaging in quality improvement, because we know when we track how we're performing when it comes to pediatric care, that we can see where our deficiencies are and take opportunities to improve them. And this has been adopted by many of these other systems like trauma systems, stroke systems, STEMI systems, which is when we engage in quality improvement, we improve our care overall. So we now know that if we are able to achieve and sustain high levels of pediatric readiness, it's associated with as much as a 76% decrease in mortality risk for children. And this is huge. If you look at our stroke and trauma and STEMI systems, they don't get anywhere close to this mortality risk reduction. On average, it's been about a 25% risk reduction. So this is really important. And we know now that we can save over 2,000 children's lives every year in the US if we could have universal pediatric readiness. And so we believe that the National Peds Ready Quality Initiative will help you get there, because it allows you to really look at near real-time performance, benchmark against national standards, which is evidence-based practices, and hopefully make improvements across the board. There's a quick question I'll just respond to briefly in the chat, and I'll turn it back to you, Lisa, which is, in smaller hospitals, do trauma coordinators and pediatric emergency care coordinators combine? In many cases, we do see that to be true, where pediatric emergency care coordinators are often assigned to the trauma manager or a trauma director, but it really depends on the hospital. Many critical access hospitals are doing shared roles like that. That's the question. So this is what Lisa is showing here, is just what we believe is the pathway to pediatric readiness. So starting by reviewing that checklist, identifying someone who can serve in the role as a PEC. They need not be a full-time position. In fact, we recognize that in many smaller facilities, it's maybe a 0.25 FTE position on the nursing side, 0.1 FTE on the physician side. But really, it doesn't take the entire full-time position to be able to do this work in smaller hospitals. So identifying the PEC, take the assessment, identify gaps, review those gaps with your team, figure out where you want to focus first, and then take strides towards improvement. You can do that by joining one of our quality improvement collaboratives, which we'll be talking about, which will kick off in January. You can do it by just enrolling in NPRQI, engaging in the toolkit. And then eventually, we now have 21 states that have pediatric readiness recognition programs. So it's a great way to really demonstrate to your community, to your leadership, that you are a pediatric ready facility and we're here to meet the needs of children. So with that, I'll turn it back to Lisa. Thank you so much.
Thanks, Kate. For those that are new to the NPRQI space or to quality improvement, I wanted to share some information about how NPRQI is really set up to support pediatric readiness. So if you're unfamiliar with NPRQI, we offer a free self-paced platform that enables EDs to securely measure, benchmark, and enhance their performance on essential pediatric processes. We offer participating hospitals a framework, or if you imagine a toolkit, for continuous quality improvement that's really aimed at the heart of pediatric readiness. This platform was intentionally designed to inform and empower frontline staff of low-resourced, low pediatric patient emergency departments. However, we welcome all pediatric patient volume emergency departments to participate. In fact, we have a high number of a variety of pediatric patient volumes that are participating in NPRQI. And next slide. As Kate was mentioning, pediatric quality improvement is the leading driver of pediatric readiness. And we know that that's associated with improved clinical care and outcomes for children. She'd mentioned that 85% of kids are seen in EDs that don't even specialize in pediatric emergency care. And we also know that there's a 76% potential mortality risk among children that are treated in EDs that have high pediatric readiness. So really the core of NPRQI really came about because we began to understand that you can't improve things that you really don't understand, the things that you can't necessarily see, the work that you all are doing at your sites, but you don't have a tangible way of really capturing what that is. So quality improvement is really all about using data to inform meaningful and actionable change. And what's really great about NPRQI is that it simplifies quality improvement by offering a set of metrics, customizable dashboards, and we throw in some support resources that really enable EDs of all pediatric patient volumes to participate. And what's really great is you do not have to have any experience implementing quality improvement. NPRQI really helps EDs to identify gaps in their quality. And again, speaking to the systems that Kate was talking about, it's really taking a holistic higher level view to look at the systems so that you can identify gaps in quality and be certain that efforts to improve are making a huge difference in the pediatric patients that you're serving. Next slide. So what you're looking at here is really the implementation flow of NPRQI to a path of better pediatric care. So it begins with accessing the free, secure-based platform, capturing pediatric patient encounter information, using that data to measure your performance, and then using that information to really kind of transform quality improvement at your specific facility. With that data visualization or that performance dashboard, you're able to reflect on your performance. You can benchmark against similar pediatric patient volume sites as well as the national performance. And then you can, again, use that information to really align specific quality improvement strategies with high pediatric readiness, as well as align strategies for your facility's mission and goals and objectives, and then ultimately be able to improve and drive results toward high pediatric readiness. Next slide. This is the framework, the 7 clinical conditions for NPRQI. We cover everything from assessment to interfacility transfer, blunt head trauma, seizures, respiratory complaints, vomiting, and suicidality. These 7 clinical conditions were identified by a group of subject matter experts who spent about 18 months really trying to identify what would be the most relevant, most useful clinical conditions for the general emergency department that doesn't really specialize in pediatric emergency care. These were the clinical conditions that the experts came up with, and they also identified 28 clinical quality measures that would deem to be the most relevant information for emergency departments that do not typically see a lot of pediatric patients. So emergency departments that are participating in NPRQI, they can choose one or more of these clinical areas of focus in terms of really improving their pediatric readiness. Next slide. Casey, I'll hand that over to you.
Right. Thank you, Lisa, and good afternoon, everyone. My name is Casey. I'm with the EMSC Innovation and Improvement Center, or the EIC. And today I'm excited to share an important opportunity for emergency departments. It's the launch of the Emergency Medical Services for Children, or the EMSC NPRQI Collaborative, formerly known as the PRQC, coming in January of 2026. This initiative is completely free and designed to support both new and existing NPRQI users in deepening their quality improvement work, strengthening pediatric readiness, and collaborating with other EDs from across the nation. The collaborative is a structured, team-based model that helps EDs test, measure, and sustain improvement in pediatric care by combining evidence-based guidance, NPRP standards, and peer learning. The collaborative turns pediatric readiness goals into real-world action, accelerating change faster than teams working alone. By leveraging your ED's multidisciplinary team, bringing together your clinical staff, administrators, and pediatric champions, or PECs, to focus on one of our 4 priority areas. Importantly, no prior QI experience is required. Teams will receive support and tools to build capacity as they go. We also emphasize sharing results and resources across sites, creating a learning network that accelerates improvement. A few benefits for your ED if you elect to participate in the collaborative is that your ED can act on readiness gaps identified through the NPRP assessment, helping to turn data into action. Using your NPRQI data, you'll be able to track progress and benchmark against peers, which helps sustain momentum and accountability. This model also supports pediatric emergency care coordinators and pediatric champions by giving them the tools and visibility to lead change locally. Ultimately, this leads to measurable gains in pediatric readiness, which translates to better outcomes and saved lives. So this is a powerful opportunity to build on or develop a culture of pediatric readiness. So let's talk about how the collaborative works and why we think you should join us. The EMSC NPRQI Collaborative supports EDs in transitioning from simply identifying gaps to making measurable improvement in pediatric readiness. It's based on the IHI Breakthrough Series model. The collaborative guides EDs from identifying gaps to implementing improvement through structured QI methods, expert coaching, and peer learning. So here's how it works. Your ED's team will work together to pick one of our 4 clinical areas of focus to work on improving. This ensures that your efforts are targeted and impactful. We then provide multiple touch points for engagement, opportunities to learn from our subject matter experts, as well as your peers during collaborative sessions, fireside chats, and opportunities for one-on-one support during office hours. You'll use Plan, Do, Study, Act, or PDSA cycles to test ideas, refine them, and make improvements that stick. While teams spend time implementing and assessing local improvement efforts within their ED, collaborative sessions serve as a forum for all participants to gather virtually and share their successes and challenges. By joining the EMSC NPRQI Collaborative, you'll have access to support and coaching to help guide you through the process. We believe Collaboration is key by learning from your peers who are facing similar challenges. You'll have exposure to a variety of approaches, which helps you adapt proven strategies to your own environment. Participation in the collaborative can support your professional development while achieving other tangible outcomes, including improved patient and staff satisfaction, plus access to resources. This is a chance to make a difference for the kids receiving care in your ED. The EMSC NPRQI Collaborative is designed to give EDs the flexibility to focus on what matters most to their patients while providing support and resources. You'll choose from one of our 4 clinical areas of focus, either pain assessment, abnormal vital sign reassessment, suicide assessment and management, or head trauma, which utilize one or more of the NPRQI's quality measures, which were developed with input from 25+ professional organizations and experts to improve pediatric outcomes. And you won't be doing this alone. We provide free coaching and NPRQI platform support, access to real-time NPRQI dashboards with the ability for national benchmarking, professional development credits, as well as access to the collaborative sessions, fireside chats, and as well as pediatric readiness and QI experts, plus the peer connections with EDs like yours. This slide highlights real feedback from past participants who joined our previous cohort. Their experience showed the practical value and impact of being a part of this effort. So from South Lincoln County Medical Center, it's a smaller hospital, and they found through the collaborative that the challenges they faced were similar to those faced by larger centers, helping them feel less isolated. They also shared that by presenting their NPRQI performance benchmark data against the national performance and their cohort, they were able to advocate for additional training for their staff. Overall, they called it a motivating and valuable experience for their staff. While our participants from Memorial Care Long Beach shared that the nurses now use data to drive quality improvement. Comparing performance locally and nationally, they're able to communicate their results effectively to leadership, and they said it transformed how they approach improvement. Covenant Hospital said hearing from larger hospitals was a game changer. For them, they were able to adapt best practices from higher resourced EDs, apply them locally, and see real changes in pediatric care. They emphasized that the collaborative gave them tools that they wouldn't have had otherwise. So these voices show, no matter your hospital size or existing resources, that the collaborative provides tools and peer learning that help to make a difference. So starting next January, the collaborative will be structured in 4 phases, guiding teams from orientation to sustainability planning. Each phase is building on the last, ensuring that progress is both achievable and sustainable. We start by getting everyone set up. Teams will gain access to the NPRQI platform, begin entering and have entered baseline data, attend fireside chats on your selected area of focus. This is also a time for you to review your baseline data and access some of those resources I was alluding to before, our intervention bundles, which will help guide you in your quality improvement efforts. And then in phase 2, we will ask you to complete the 2026 NPRP assessment, attend collaborative sessions, and begin planning for your quality improvement project. Data entry will continue throughout this phase, so you can continue to monitor your performance. And during phase 3, we will begin implementing PDSA cycles with ongoing coaching and support. Additional data entry continues throughout this phase so that you can monitor your performance and identify changes that are a result of your improvement efforts. So finally, we will help to focus on sustaining your gains and planning for long-term success and reviewing opportunities to stay connected and continue learning. So joining, hope that it's a straightforward process of joining with built-in support at every step, from registration through sustainability. Each phase is designed to make participation manageable and meaningful for you. We'll start by engaging your ED leadership and staff, we have a flyer that we'll share with you to get you and your team excited about this opportunity to improve pediatric readiness. And then if you are new to NPRQI, you'll first register for the platform and then share in that process that you're interested in participating in the collaborative. You can join anytime between now and January of 2026. If you already have if you are utilizing NPRQI already, we ask that you send us an email at collaboratives@emscimprovement.center. I'll put that in the chat for you all in a minute, so that we can help you get enrolled in the collaborative. Once you have signed up, we ask that you go ahead and begin assembling your team for the collaborative. Make sure to involve your ED's PEC. They'll be a great champion in supporting pediatric readiness. You can add members who represent different roles within your ED: nurses, physicians, administrative staff, child life, quality improvement specialists, health informaticists, just to name a few. Then you can get started today utilizing the EMSC NPRQI Collaborative flyer to spread the word and to sign up for NPRQI and start building your team. Under a reminder, we are here to provide guidance and help to make this a successful experience for you and your ED. So thank you so much for your time and attention today. We truly hope that you're going to join us next January for the launch of the EMSC NPRQI Collaborative. And if you have any questions regarding this opportunity, or if you would like to schedule a one-on-one chat to discuss this further, go ahead and I'll put that email address in the chat in a second, and you can email me there and we can set something up. We also have some time now to help address any of your questions. So feel free to come off mute or share your questions in the chat regarding this opportunity and what it might look like for you and your ED in the future.
Casey, I just wanted to remind folks that I had put in a couple of links into the chat. So there's the website for the EMSC NPRQI Collaborative, where folks can check that out. I put in the link for the upcoming 2026 NPRP assessment. I've also uploaded in the chat the participant organization agreement that is needed and required in order to participate in the collaborative and to participate in NPRQI. And then you had mentioned some office hours. I put the link in there, as well as the registration link for NPRQI.
A question in the chat: how is this different from last year's NPRQI project? And are the data points and questions the same? So maybe we're referring to the PRQC collaborative that took place, ended last December in 2024. So in terms of the collaborative and the opportunity to engage with other EDs and utilize NPRQI for quality improvement efforts, it is a name change to help streamline our efforts. The collaborative and the purpose behind it are the same. At the same time, this could be alluding to some of the upgrades to NPRQI that we've been sharing with you all, and some of those changes that are coming related more to the data points that are collected. I don't know if you want to address if there's any changes to those.
Yeah, there's no changes to data points that are collected, and I'm actually putting that in the chat right now. So you can actually see all of the questions that are in the data portal. So you can get a look at that. And Casey had mentioned that we are excited about some upgrades to the NPRQI platform that are coming in the near future. So what that means is, if you haven't already, if you are an existing user for NPRQI and you haven't already, you will need to submit the updated participant organization agreement. And that's what is actually in the chat, the document that I uploaded there. We are requiring a new participant organization agreement because we are bringing the platform in-house to the University of Texas Dell Medical School. Currently, it is being hosted by an external vendor. We are now bringing the platform in-house to Dell Medical School. So we do need to update all of our security requirements. So we encourage folks to get that submitted as soon as possible. We've had many sites that have been able to get that to us within a week. Other sites may require a little bit more time. We just ask that you route to the appropriate authorized signatory to sign off on that participant organization agreement, and you can get that submitted. You can send that to the NPRQI email, and we can get that process started for you. Yeah, and Kate had mentioned in the chat, she's talking about how the collaborative is still going to offer coaching and support, structured discussions. We will still include opportunities to focus on optimizing pain management, suicide screening, as well as assessment and reassessment of high acuity patients. A new clinical area of focus is going to be blunt head trauma. Casey, did you have anything else to add?
I was just maybe gonna ask Stephen to sort of let us know if we covered your question or if we were maybe off track there. I want to make sure we were.
I'm good. I think, you answered all my questions.
Thank you.
Here's the screening.
I'm sorry, you weren't able to make out the question.
I just was asking if this was Stephen Rogers, the national leader in suicide screening. So that's why I was curious if that was the same Stephen that was on the call and what that's the reason for the question.
I wasn't able to get that, Casey. Were you able to understand it?
I was not.
Okay.
No, I
You are
couldn't
welcome
understand her.
to,
Okay.
yeah. You're welcome to send us an email and we'll be happy to answer any questions that you have. I think Casey put in the collaborative's email in there, and I also put in the NPRQI email.
Okay, thank you.
We are looking forward to building on those areas of focus that we had previously focused on, offering new resources and updating those as we speak, and then preparing to support you all in beginning to look at head trauma and those quality measures as well.
Casey, I know we had a few more slides. Do we want to go ahead and move forward with those? So just in terms of NPRQI supporting your QI efforts, we've talked about utilizing the platform, utilizing the NPRQI office hours, and I'll share some more information about that, but also just wanted to just emphasize the importance of quality improvement in pediatric readiness. You can go to the next slide, Casey. So again, we really can't emphasize enough how significant pediatric quality improvement is to really driving the work of pediatric readiness. And again, just understanding that it's really difficult to wrap your head around things that you can't understand. And what's really great about NPRQI is that it really helps to make the work that you're doing tangible. These performance dashboards are so transformative to be able to get a screen print of that and to put it into a PowerPoint presentation that you're going to be doing to your quality improvement committee, to your EMSC trauma region meeting, to your hospital leadership, to really help folks that are influential and to help support this work, to really understand and make the work that you're doing very tangible. Next slide, Casey. So we talked about the office hours. So these are really helpful resources from what we're hearing from a lot of our participating sites. They're able to schedule one-on-one support. I put a link in the chat for our virtual support on our website where you can go in and you can schedule. We offer twice a month Our first one for October is going to be October the 14th, and we offer a few selected times. You can sign up. It automatically sends you a meeting invite. If you're just getting started and you have like so many questions, maybe you're new to the position. A lot of times we'll have folks that will sign up for office hours, PACs, or folks that are filling in the role for a PAC and going, I don't know what I'm supposed to be doing. I'm new. And so we just get started from there, and we really help to kind of build the resources that are available to you. So during office hours, we talk to you about how to get started with quality improvement. If you're already familiar with quality improvement, we can talk about getting started with the data platform, identifying chart sampling strategies, identifying ways that you can streamline the data entry. And what's really nice about NPRQI is we really put the ED in the driver's seat. We do not dictate in any way how this should be implemented at your particular facility, because we understand that many of the participating sites are low-resourced, low pediatric patient volume sites. And so however you can make this work at your site is the way that you should do it. Some sites have the luxury of having a partially funded position that this is all they do. They do pediatric readiness. They do quality improvement. We have other sites where clinicians are actually taking on pieces of this role in their extra time, or oftentimes in their off time. They're that passionate about this type of work. We have some sites that are trauma designated sites. They do enter data into the trauma databases. They also do this type of work. They also do the data entry for the pediatric readiness. For them, that's just kind of an easy win. But again, just identifying how this is actually going to work at your site is going to be left up to you all. And so really kind of meeting with folks, helping them to unlock insights, identify those high impact areas of focus. And again, provided that tailored quality improvement coaching along with intervention strategies. If you need help understanding and interpreting your performance dashboard, we can assist with that. We can help you identify, here are some areas that you may want to be considering in terms of quality improvement. And here are some resources. A lot of times we have intervention guides that are already established that we can share so that you don't have to recreate the wheel. We've got resources if you wanted to do an intervention around education, around policy and procedure, around optimizing your electronic medical record. So anytime you have questions about the quality improvement work that you're doing, we are happy to support that work. Next slide. So there are three tenets as part of NPRQI. It is to measure, reflect, and improve. And through measuring, you're going to be enrolling and customizing your work, where you're able to choose from those 7 clinical quality conditions, as well as being able to use and have access to 28 nationally vetted pediatric measures that align with those clinical conditions. It's simple data entry. It's de-identified patient data through the secure platform. Right now, it is manual data entry, and that was very intentional when we established this particular platform, because we were specifically targeting, again, low-resourced, low technology, low pediatric patient volume sites. We do have some plans to ultimately be able to have electronic data pools for our platform, but right now it is manual data entry. With that data entry, you're able to create performance dashboards so that you can analyze the data. You can track performance and trends using an interactive dashboard, create reports. Again, I'd mentioned you can compare your ED to similar volume sites, as well as the national aggregate performance. You have the ability to share these insights. You can use these images to really build awareness around pediatric readiness, to drive buy-in, as well as to help secure any staffing resources to do this type of work. And then ultimately, the goal is to improve pediatric performance. So using that data to really turn insights into action. So being able to implement evidence-based changes and to track in real time your performance. So you enter in the data, you identify a specific strategy, you implement that specific strategy. And what's really great is that this doesn't have to be something that's 3 months long. You can implement a specific quality improvement strategy for 3 shifts. And as you are implementing it, continue to enter data and track your performance. Look at the graphical interface and see, are we making a difference in what we're doing? Do we need to tweak what we're doing? Do we need to identify a different type of intervention for this specific area of clinical focus? And then again, ultimately to sustain long-term excellence. So really developing a comprehensive pediatric quality improvement plan with data, resources, and a collaborative network. We also are developing an amazing library of communication and marketing products. A lot of times you are thinking, well, I'm not going to be the decision maker. I need to share this with somebody else. We have an ED leadership and C-suite promo package that already has talking points that you can just copy and paste and put them in an email and send those off. And we have our NPRQI website that we're continually updating. We also have our collaborative flyer that Casey was mentioning earlier. We've got some promotional packages. We've got the quick start enrollment guide, as well as a couple of NPRQI infographics that you can share with staff at your facility. You can share with leadership. You can share with people that can really help build support around this type of work. And the next slide. And then just pausing again for questions. We know it's a lot of information. You all are welcome to enter questions in the chat. You're welcome to unmute. You're welcome to use the emails that we entered into the chat to reach out with questions. If it would be helpful to actually meet with a few of your staff at your ED, we are happy to do that as well. We are frequently meeting with sites just to share information. Even health networks will reach out and say, hey, I really want my sites to be involved in this, but I would like for you to come and be able to present some of the information to our group. And we are happy to do that as well. Let's see, there was a question. I got a question about, will the logon still be the same? So if you are a current user of the NPRQI platform, you can continue for now currently using the login credentials that you have and linking to the platform via Clario. In the coming months leading up to January, we will be sending out communications about what to expect. And in January, we anticipate to be launching the updated platform. At that time, you will receive an email from UT Dell Medical School asking you to create new login credentials, and the URL that you're going to be using will be different. So I hope that answers your question. So again, if you're a current user of NPRQI, you can continue to use the data portal, the data visualization dashboards, as they are currently hosted by our external vendor. If you haven't already, you will need to submit the updated participant organization agreement so that you can have uninterrupted access to the NPRQI portal into 2026. Great questions. Well, we hope this information was informative, really just to kind of sum up the collaborative and to sum up the data portal. It's really all about getting better data so that you can make better decisions and ultimately provide better pediatric emergency care. Thank you all so much for attending today's webinar. We will hang out for a little bit to see if y'all have any questions. Thanks, Stephen.